Welcome back to another episode of the Grow RDH podcast. Today's a really exciting day. We have an interview with Katie Bearer. And Katie is a certified aesthetic injector that hails from Kansas. She elevates her traditional hygiene skills by integrating Botox and dermal filler into her practice, viewing them as essential components to enhance patients' self-assurance and improve their overall dental health and function. She is a faculty member of the American Academy of Facial Aesthetics and looks forward to contributing to the evolution of dental hygiene by educating other hygienists and healthcare professionals. So, Katie, I just want to say welcome. Thank you so much for giving us your time, and we really appreciate you being here with us.
Thank you.
I just want to give you the floor. If you can tell us a little bit about yourself, your background, any fun facts you want to share, the floor is yours.
Absolutely. So I have been practicing hygiene 12 years now. I think in June I just hit my 12th year. I started my career in Philadelphia. I spent the bulk of my time there working in a general practice. So, we did all of the traditional things, fillings, crowns, etc. But the dentist that I worked for really had an aptitude for cosmetic cases, cosmetic dentistry. So I really kind of got my first taste of that facial aesthetics in that practice. We weren't doing Botox and dermal filler, but I always kind of reflect back and look at that experience as maybe the foreshadowing as far as what was to come. So started there, fell in love with my career as a dental hygienist, thought I had found my forever home in dentistry, and then found out that I was going to be relocating to Kansas City. Did that 3 years ago. So now I practice actually just outside of Kansas City. And pretty much as soon as I moved here, I found out that legislation had passed for hygienists to be practicing Botox and dermal fillers. And I always joke and say this was a run, don't walk opportunity for me. At that point in my career, I was about 9 years in and was starting to get that kind of 10-year itch of wanting something more, ready to kind of expand my scope of care. So I jumped on the bandwagon with that and became certified and really never looked back. So it's been a lot of fun.
Yeah. You might have already said, what year did you graduate from hygiene school? How long have you been a hygienist?
2012.
Okay.
Yeah.
Yeah. So I just like relate to the 10-year itch where you're just like, okay, what is next?
Yeah.
And so you said, coming to Kansas where they had that experience of going through the legislation for it to pass. Was that sort of your initial motivation? You talked about your background in aesthetic dentistry. So what legislation changes made that possible? How did that happen? Can you briefly sort of give a background on that?
I can. So, kind of peripherally, admittedly, I was not responsible or involved in any way in those changes. They preceded, my time here in Kansas, me coming to Kansas. So, I didn't have a hand in kind of being a catalyst in that change. But, based on conversations that I've had and what I've learned now that I've kind of thrust myself into this world of learning everything I can about Botox, I know that it takes a lot of effort from our dental hygiene leaders. Especially in our state ADHA chapters and our representatives there. I know it takes a lot of funding from membership. I know it takes a lot of lobbying and just trying to, get everyone kind of unified and on the same page of what the desires are of the hygienist before, presenting it to the dental board. My understanding is still kind of that of a layperson. I'm trying to educate myself and learn more and more as I can. But it's an arduous process and not just for the incorporation of Botox and dermal filler. I think it's really trying to see any change in our profession. It really takes a lot of effort on everyone.
Yeah.
That's what I know about that.
Yeah, totally agree. So much goes into it on the back end that I just don't think people realize how much it can really take to get things, even the ball rolling. And then when you get to that legislative process, it really can be difficult. So thank you for
Yeah,
sharing.
of
Um,
course.
how did you prepare for offering any injectables? And you can kind of speak about Botox or dermal fillers or whatever you sort of specialize in. What kind of training, certification, what did you go through?
So I was certified through the American Academy of Facial Aesthetics, who I now happen to work for. That was a really wonderful, comprehensive program. No, I'm not saying that just to tout them because I work for them, but even if I didn't and I was just a student, it's really great. So they provide a lot of comprehensive training. They provide training modules that the students have to study on their own before coming to a live in-person training. Now, that being said, Kansas did require that type of certification. Um, and I always preface by saying I can only speak to what Kansas requires. I don't know what the other states require, but they did require. I think it was 20 hours of certification or 20 hours to be certified before being able to take it into the dental practice. But yeah, it was great. It was just kind of refreshing anatomy. I always say hygienists, we have the best foundation for this type of stuff because um, facial anatomy, head and neck anatomy is something that we all learn and come to know very fluently through dental hygiene school. Some of the areas of treatment, I don't use in everyday dental hygiene, traditional dental hygiene practice, but it's like riding a bike. Like once you start seeing it and studying it again, it all comes flooding back. So, yeah, that was what my training was like and kind of how I prepared, at least for my certification.
Yeah, that's awesome. And can you just share what you say you work for the American Academy of Facial Aesthetics? Can you
Mhm.
just share a little bit about what you do for them? Do you do a lot of trainings now?
I do, yeah. So I travel with them approximately once a month all over the US. As a matter of fact, I just got back from San Francisco on Saturday night. But what we do is we travel the country and we train healthcare professionals. So yes, hygienists, yes, dentists, but we also train um, MDs, NPs, RNs, and all the in-betweens, the art of injecting Botox and dermal filler. And to be honest, the dental professionals are the really great ones. Not that the other
Yes.
ones aren't. Everyone can get there, but
Yes.
with this stuff, like we all put our pants on the same way, right? Like everyone comes in clean slate, but the dental professionals definitely have an aptitude for this stuff.
Well, and it just makes sense, right? That this is our area of expertise.
Hmm.
This is
Yeah.
what we do. We're in the mouth all the time. We're in around the face. I mean, it's just kind of our bread and butter, if you
Yeah.
will.
When it's funny because, when we're injecting dermal filler in the perioral region, sometimes you have to put a finger inside of the patient's mouth to kind of massage and smooth things out. And when I tell like the doctors that or the nurses that, they're like, put my finger in their mouth. I'm like, yeah, just put it on in there. Or, giving dental anesthetic blocks for dermal filler, their half of the medical community isn't as comfortable with that. But anyways, they're still
I
great.
love
They still end
I,
up great.
I just love that. So thank you. Yeah, thank you for sharing that. That just makes me proud.
Hmm.
So you went, got certified, and now you're coming back into your practice. What challenges did you face introducing those into your practice, like from a clinical aspect, but even from like a patient aspect? How did that
I
work?
think from a clinical aspect, just kind of figuring out and navigating this new world kind of independently. Um, there was no one on my radar that had kind of forged this path for hygienists before. So it was really all just kind of self-taught, like, okay, what systems do I need to develop so that, um, our providers can communicate effectively with the front office about this stuff because, everyone in the office is learning this stuff for the first time. You could be in dentistry for 20 years, but you've never, checked a patient out for dermal filler. You don't know what Botox costs. So, creating seamless systems for the practice, um, figuring out what vendors I needed to be working with, what suppliers I needed to be working with, what supplies I needed, what type of insurance does the practice need to carry now, kind of things that you don't think about that keep a dental practice humming and moving smoothly. For, traditional dental care, we had to think about all of those things, to incorporate Botox and dermal fillers. Challenges from a patient standpoint, I think it was really just it's taken quite a bit of time to get patients and my own personal network, friends and family, to understand that I'm certified. I didn't just, watch a YouTube video and teach myself this. Um, dental. I've also had to do a lot of I'm not a dental assistant. I know dental assistants are wonderful, but I'm a board certified healthcare provider, licensed to give these treatment modalities. Nurses and doctors aren't the only ones that can. Um, I think the term dental hygienist is a little bit of a misnomer. I've kind of been leaning into that lately because to me, that just implies that we have one skill, and that's cleaning teeth.
Yeah.
Um, so I've tried to kind of, educate and open people's minds to, we do so much more than that. Even when you are just in our chair cleaning your teeth, or doing so much more than that. So it's just taken time to kind of get people comfortable with the idea that dental hygienists can be doing this and we're qualified to do it. But fortunately, people have come around, and we're really building a great practice with this.
So, yeah, that kind of leads into the next question. What impact has this had? One, on your patient in terms of growth and retention, and in terms of your practice on just the opportunities that are now available to you?
Yeah, I mean, financially, it certainly had a positive impact on the practice. I've said it before, production shouldn't be a four-letter word in dental hygiene because no one wants to work for free, and we have to be profitable in order to be able to turn the lights on every day. So, it it's had a financial impact in a positive way. I can see patients in my chair that don't require time from the doctor. So I can schedule, Botox patients, and the doctor can stay in surgery. She doesn't have to excuse herself to do a hygiene check. So, are we setting the world on fire with, Botox patients lining out the door? No, because that's just not, our vision for our practice. But it certainly has been a wonderful, and profitable benefit to the practice.
Do you have any patients that are just super excited now that you offer? I mean, do you have any like fun stories of like patients that are kind of like the light bulb goes on? They're like, oh, this is offered. This makes sense here in a dental office, in a dental setting.
Yeah, I mean, fun stories. I don't know. I don't know if I can think of any fun ones. I mean, they're all great. I adore all of my patients. I'm fortunate to have great patients. But patients who come in and, they're the chronic bruxers and they're in the night guard, but the night guard always ends up, you know, under the pillow, or even they still wear their night guard all night long, but they're still waking up with, jaw pain, muscle soreness. Um, it's really gratifying to be able to provide this to patients now as just kind of an additional treatment that can kind of round out their care. And the response has been fabulous. Patients now are coming back, for third and fourth recalls for these treatments. So the proof is in the pudding. And I always say to patients, like, hey, listen, good news. You're going to invest a little bit of money in this. And if you find that it's not for you in 3.5, 4 months from now, if you don't love it, you don't ever have to do it again. Like, you really don't have any skin in the game. So, once you kind of preface it like that to patients, especially those who've been in chronic pain, they're usually willing to try. And 10 times out of 10 so far, they've all been very satisfied with the treatment. So it's satisfying to see.
Yeah. Yeah. Patient satisfaction is one of the like best, it's like full circle. They finally are
Hmm.
light bulb moments, aha moments. They're like finding relief or finding,
Yes.
so that's exciting. So looking ahead, do you see the role of injectables evolving? How do you see that evolving into dental practices? Do you see it as a coming trend? Is this becoming a trend, and or what other techniques or any emerging ideas that you're excited about in the injectable world?
Yeah, I mean, I would like to see this sweep the nation. I think every dental hygienist should have the opportunity to have this in their toolkit if they choose. To me, it's, no different than every hygienist being able to inject anesthesia or use lasers. I think that we should all be given the tools to treat our patients in the most comprehensive ways, and then based on our own preferences, and philosophies of care, we can kind of pick and choose from those tools what we want to provide to our patients. So that is my hope and wish for our profession. Um, at least on a therapeutic level, we should all be able to offer this to our patients. I offer it as well for cosmetics, and patients love it. And I love to be able to do that for patients. I think for some states, that might be a bigger hurdle to get over. Um, but as far as, new and emerging things, I know that there are talks of using certain types of dermal fillers, ones specifically that stimulate collagen production. I know there's research being done in the gingiva. And so, not necessarily to grow back tissue that's lost, but maybe just to stimulate it in a way so that it's a little bit more robust in some areas. I think these studies are early on, but I think they will be emerging, and hopefully in the future we can be using these modalities in more ways than, just on the face, hopefully inside the mouth more.
Yeah, that is really exciting.
Hmm.
That's neat. That's very interesting. I'll have to look up some of those articles.
Yeah,
Maybe I can look them up and post them as links when I post the episode.
yeah,
I might
that'd
have
be awesome.
to. So for any hygienist that may be really interested in this and they want to just get their feet wet, can you give us like a brief rundown? We've been referring to Botox and injectables. What what injectables do you primarily work with? Is it, you mentioned dermal fillers? Can you kind of give us like a surface level? What is that?
Yeah. Hmm. So, a dermal filler is a hyaluronic acid based filler, kind of looks like a clear jelly. And depending on the type of filler, they can be kind of smooth and almost runny to really thick and kind of structured looking. And we can use dermal filler to build volume where volume has been lost in the face. So, of course, we all know about lip filler. You can use it in the chin, in the cheeks, in the temples. Um, there are many indications for it. There are cases where dermal filler has been used in the papilla to fill black triangles. So that's dermal filler in a nutshell. And then you have neuromodulators, which everyone knows by the name brand Botox. It's kind of become a household name, but Botox is just the name brand for that specific type of drug. A neuromodulator is a drug that modifies the behavior of a muscle by inhibiting the release of acetylcholine in the muscle, which is the neurotransmitter responsible for muscle contraction. So we use neuromodulators. For example, if we have really overactive masseter muscles and we want to quiet the muscle down, we can inject bilaterally into the masseters, which then will reduce the muscle contraction, which then will reduce, bruxing forces, while still allowing the patient to have, complete competency of the muscle, if you're dosing appropriately, that is, which everyone would. Um, yeah, and so additionally, for using it for cosmetics, we can use it in the frontalis muscle. Treating this muscle here then prevents the dynamic movement of the muscle, which then will prevent, the muscle, the skin to wrinkle when the muscle contracts. So that's like a high level Botox dermal filler overview.
Perfect. Perfect. Thank you so much.
Yes.
I appreciate that. Just one last question, sort of as like a ending motivation, get out there and do this. How has this overall changed your career path?
It really has just kind of revitalized my zest for the career, I guess you can say. I love traditional hygiene, but scaling and root planing and prophies do get a little monotonous, especially after, 12 years now, like I said. So it's just given me kind of a renewed kind of sense in the career and the profession, and it's something to look forward to. I love to learn. I love to try new things. I never want to be stagnant. So it's really just been fulfilling to learn something new and have something, a challenge to look forward to, and switch it up, shake it up a little bit.
Yeah. Yeah.
I
I
hope
love that.
others will find that the same.
I was going to say, I just think that we all get to that point in our careers where we're, yeah, a little stagnant and we're looking for satisfaction again, right? We all
Hmm.
want to be satisfied. And sometimes people talk about like work life balance and finding this, and it's really about finding satisfaction to me, is because you want to leave at the end of the day feeling like accomplished or feeling like
Right.
you are contributing or you did something. So, yeah, I really,
Absolutely.
really relate to that. So
Yeah, for sure.
yeah, I just want to thank you for your time. I really
Thank
appreciate it.
you.
I think all of this information is so valuable and it's so exciting. And I think it's going to give a lot of hygienists a lot of hope and something to strive for, look forward to. So I appreciate it.
Thank you, Katie.